to take this time out of your busy work. We're very appreciative of you being here, and we hope that it'll be worth your while. And it's very important because you're bringing your experience and your expertise along today, which will be of huge benefit to ourselves. So thank you. Now, you might have wondered what's this QR code and so on. We're going to be using, hopefully you have a smartphone with you, and what we'll do is, as we go along, we'll ask you some questions, and you'll be able to put forward your ideas and so on using your phone and pressing submit. And the good thing about that is it's all anonymous, and when the ideas and so on come up, we'll all be able to see them on the screen. So we'll be doing that. So hopefully you'll be able to take part, because we're very keen to hear what your thoughts are and so on. So in this little workshop, I know it's billed as a webinar, but it's more about a workshop. Let's see what we'll be doing today. So with our workshop, we're going to have a brief intro to what is good rehabilitation and care. And I'm sure that you'll recognise the things that you're doing in Beth's intro. And we'll be focusing on good rehabilitation, getting your views. Then we'll move into small group discussions, and we'll wrap up the comments and have concluding thoughts at that stage. Stephen is working in the background. He'll be putting us into groups and so on and so forth. And he'll keep me right if I'm, if anything goes amiss as we go along. So the first thing we wanted to do is let's try this out. Let's see, can we use our smartphones? For those of you who missed the bit at the beginning, here's the QR code. If you're able to, please scan that QR code on your phone, or there's a web address at the end there as well, ahaslides.com, and a long number there. If you type that into your phone, up will come a question saying, tell us about your work. So add anything you'd like to share. Where is it? What type of work do you do? Who do you work with? What's the best thing about it? So let's give that a shot. I'll turn that off and let's see if we have anything joining us here. So you can fill that in on your phone and submit anything. Oh, there's somebody from Scottish Government. So pop in anything that you think would be good to tell somebody working in a care home, anything you'd like to share. People in Glasgow. That's great. We've got somebody working in Edinburgh. We've got an OT. Dumfries in Galway. Oh, that's lovely. We've got someone from Community Rehab OT. Summerlee House in Coatbridge. Hello. And there's a physio. Well, this is lovely because it's fantastic to have people from both care and health, because when we work closely together, it really helps the lives of the people that we're supporting. And a wellbeing team in Hillside View in Paisley. That's great. And CEO of a charity running 2 care homes in Greenock. Hello. Wow, you've employed 2 physios. How lovely to hear that. A huge difference to our residents' well-being. Fantastic. Listen, why don't you put in, what's the best thing about the work? Because you're allowed to put in multiple answers. So maybe you could pop something in there, and you can see that everything just comes up automatically. It's all anonymous. There's somebody from East Ayrshire Care Home. Great. Oh, really enjoy getting to know people. Making life better. It's lovely. Making a difference to people's lives. So there's some lovely ideas there, and it's just nice to get a sense of who's in the room. And oh, I love that, getting to spend quality time with residents. Oh, more quality time. That's great. And achieve their goals and seeing the difference. Fantastic. So it's absolutely lovely to see who's here in the call this morning. And I'll also you know, the good things about work. I know things are difficult and there's huge pressures on everybody. It's nice to just connect back with the thing that gets us up in the morning and keeps us going. Thank you so much for that. Now, this is just a fun one. And again, it's just to get you used to this idea of you using your phones. So it might say on your phone that the presenter has moved on. You'll have to go to the next slide. But on a scale of cat, how are you feeling today? And on your phone, if you click it, the picture will get a little bit bigger. I love this. I love looking and seeing how people are feeling. There's 6 people feeling like number 5. Don't know how to describe number 5. Looking okay, looking quite chirpy there. We've one who's just collapsed in the corridor feeling, oh, things are a bit much. One taken to the drink there with number 5. One looking quite startled, the black cat, number 3. So sometimes it's nice just to be asked, how are you feeling? And I guess that's how people are feeling this morning. I'm feeling a bit like number 6 as well. I'm feeling, which is the chirpy one, 9 people are feeling like number 6. So I'm feeling a bit positive today and just really pleased to be here in this webinar and pleased to be working with you. So, and I got out this morning to go for a walk before work, and that always cheers me up. Sometimes I have to remind myself of that in order to go out for a walk, but every time I go for a walk, I come back and feel better for the day. So hope you've had a good start to your day. Okay, so you're all dab hands at using the wee phone. If you've got a problem with it, I think Stephen has, I can't actually see the chat, but I'm sure Stephen has put the code into the chat for this webinar, and you can have a look at it there and hopefully figure it out. Right, so I'm going to hand you over to Beth. Hi Beth, are you there?
I am, yeah.
Okay, and actually for folk, if you're, oh, there's Bryony as well. Hi Beth, hi Bryony. Sarah, I don't know whether you might like to put off your camera just to give a little bit of space there. We'll be talking to people later on. So if you're not presenting, you might like to turn off your camera just now and your microphone. Okay, Beth, over to you.
Okay, Louise, thanks very much. So I'm Beth Locke. I'm currently EHP Professional Advisor in Rehabilitation at the Scottish Government. And Bryony, do you want to introduce yourself?
Hi everyone, I'm Bryony. I'm the Senior Policy Manager in the Clinical Priority Team, so I look after diabetes, respiratory and also rehab.
Thanks, Bryony. So the two of us that are working together as part of the team that are leading on the implementation of the rehab framework. And we really appreciate the opportunity to speak today about rehabilitation and get your thoughts on it. So over the next few minutes, Bryony and I will just kind of talk you through a wee bit about where we're at with rehabilitation and the implementation of the framework in Scotland. So just to kind of start off in terms of thinking about what rehab is, and I guess for us, we've had quite a lot of conversations around about the breadth of rehabilitation. And I thought this slide was maybe quite useful just to describe what we mean when we talk about rehabilitation, because we talk about it really in its broadest sense. So we've got a triangle, and I'm sure folks are quite familiar with that type of model, where we go from kind of very kind of generalist and universal approach to really specialist. But we've turned this triangle on its head because what we kind of recognise is that kind of tier 1, that self-management, the early intervention, really is probably the biggest part of it, and probably the most important in terms of the contribution it makes to overall provision of rehabilitation. So if I just start really, let's say really briefly about kind of tier 4, which would be our kind of very specialist or highly specialist rehabilitation that would quite often be carried out by specialist therapists, and it would very often be kind of condition specific, so kind of stroke rehab or cardiac rehab. So I'm sure you kind of get the gist of what that might be. Kind of neuro rehab would be another example. So kind of much smaller numbers, very specialist skills, because it's quite focused on, as I say, a condition, but kind of moving up into our tier 3, where it's more generalist rehabilitation. That would maybe be kind of community rehab, so community rehab teams that see people with a whole range of conditions, and in fact see people who very often have, you know, a number of conditions, so that kind of multi-morbidity, very often older people. So you'd probably be familiar with the community rehab teams. They quite possibly come into your care homes. And tier 2 would be the prehabilitation, which is the bit about, you know, what can you do in advance of quite often surgical intervention. So people with cancer, for example, who've got a diagnosis, who are facing maybe quite invasive surgery or interventions around about chemo, and that preparation for that. So what can they do to get themselves, you know, as well as they can in advance of that? So that would be prehab. But the bit I guess we probably want to focus the most on today is that tier 1, which is actually more of an approach, I think, rather than an intervention. So interventions, of course, have their place, but actually the bit about tier 1 is just an approach about how do we work with people. I think what came up in one of the earlier slides was about that time to get to know people, to understand where they're at and understand what's important to them, and really be able to provide and facilitate activity and rehab that really is tailored to their needs. So what is it they're interested in? So very much focused on the individual. But as I say, it's not necessarily about, you know, a physio coming into the care home and providing interventions. At this level, it's really about what can the care home do in a way that really supports individuals and the residents as a whole. And we quite often reference CAPA as part of that, because we recognise the good work that we did through that that particular innovation. So kind of building on that as we go forward. So hopefully that gives you a flavour, kind of stumbled through that a wee bit, but hopefully that gives you a flavour of what we mean by rehabilitation, and hope you can see that we are viewing it in a really broad way as part of the focus for our conversation today. So I'm going to hand over to Bryony, who's going to talk you through the principles of good rehab. So next slide, please.
Thanks, Bet. So when we were coming up with this programme, we wanted to be able to measure, or just at least prove, what we were doing was working. And because, well, Bet's just outlined quite clearly how broad rehab is, and I think even just the word rehab is really difficult to articulate sometimes. So we came up with these principles, and I said this last time, I keep calling them hexagons. I actually don't know what shape they are, so if anyone does, please correct me in the chat. But we came up with these 6 principles to show what good rehab is, and although they just kind of look like words on a screen, there is a bit of background behind each one of them to really show what we mean by that. And we developed these with a big group of people, and they're absolutely open for discussion and debate when we come into the actual projects of the programme. So everything from today is going to inform what our next steps are and what gaps we need to fill within rehab in Scotland. And we will then use these 6 principles to measure if they are working towards good. So we've got things like realistic and meaningful to the individual. That's based mainly on the principles of realistic medicine. So not over treatment, things like that. Good value to the person and to the organisation. Provided at the right time. There's a good bit of chat about that at the last session with the care home staff around how do you actually get the right time, and that'll be different for every individual. easy to access for every person. Again, that also really includes the staff. So if you are a staff member in a care home, how easy is it for you to find rehabilitation services, and what's the access like? Delivered by a flexible and skilled workforce that incorporates every type of person, and the use of the word workforce, again, that's still up for discussion around what exactly that would include, but it would be different for every project. And really that one in particular, we're just looking to find out if there are skill gaps, or if we can use other services out with maybe traditional NHS services to support rehab in other areas. So hopefully that makes sense, but we can share these slides, and we can share the bigger description of each of the values as well.
Great, thank you. Thank you very much, Bryony. Right, so having had a look at, you know, what is rehabilitation all about, and in particular this tier 1, this broad approach to rehabilitation, where it's early intervention from, you know, from everybody involved, from the person themselves, families, staff, people connected with the care home. And these principles, what we thought would be good is to ask you what your experience is at the moment, about you know, taking a snapshot of the current situation. So a question will come up in your phones in a wee second, and we'd ask you, without overthinking it, what's your experience now? And with these 6 items, there'll be a scale, and there's no right or wrong answers. Your answers will reflect a moment in time from the experiences of those today. And we'd love to know, do you agree or disagree that, for example, rehabilitation is provided at the right time? And there's a scale that you can choose from. Okay, so let's go on to the next one and see how you get on. So do you agree or disagree that, for example, people experience that it's easy to access? Good rehab at the moment is easy to access? Or that it's delivered by a flexible and skilled workforce? Is it ambitious and innovative? So you choose, you can go down, you can skip some, and you can input when you press submit. It'll go through, and you can just pick from a scale. And again, you know, just your, you know, without overthinking it, just what your experience is at the moment. And you can see it all appearing. It's fascinating when you see it on the screen. And we'll see. I'm sure it'll be very, very different. And what's nice is we've got a mixture of people on the call from managers of care home, people working in care homes, OTs, physios. And I know, obviously, we know that the experience is really strange and difficult given the times we're living in. But just at the moment, what does it feel like? And as you go down, you can select each of the 6 questions. I think you press submit at the end or something. So what do we have? Oh, all right. Okay. Well, I'd say people have probably had a chance. So let us see. So we go with the first question. So for the people on the call, that's interesting, because for people on the call, if we just take the average of it, it's at 2.6, but you can see that some people think, no, it's definitely not easy to access. And here we have 3 people figure it is easy to access, and 3 people think it's not, and we have another 3 over here saying really disagree that it's easy to access. So very different experiences. It's more over to the right-hand side, you can see this time, that folk believe that rehab is delivered by a flexible and skilled workforce. So more people on the right Though again, there's one who really disagrees with that. So I'm sure it's going to be very different depending on who you are, where you're working. Provided at the right time. Ooh, you can see it. That's a really interesting one, isn't it? That it's kind of more to the disagree end, more people over that side, that it's provided at the right time. And of course, that's always a conundrum, isn't it? Is it realistic and meaningful to the person? And again, with some people thinking, no, it's not. And we have two people on the right saying absolutely, reckoning that this broad approach to living the life they want to live, supporting people to do things for themselves and so on is happening. Is it innovative and ambitious? Again, a bit of a mixed bag. And integrated again across sectors, that's more to the left, isn't it? So not people here don't experience as integrated across the sectors. So that'll be a really interesting conversation in a wee while. Okay, so thank you very much for that information. Let me just check our next slides. And okay, now, given this discussion so far, what we thought would be good is for you to have an opportunity. Oh, there's some sad faces there. Somebody's saying that this is a sad situation, a sad mixture of the reflection of reality. But now we'd like to give you an invitation to talk to others who are on this call and to put your views forward. And we've been looking at what's happening at the moment, but now the task for you is to look to the future. And we want you to imagine a great future. So it's 2025, and we're living in a time, we're working in places where there's excellent rehabilitation, this early intervention for self-management. So the person, the families, the community, all of the different AHPs are all working seamlessly together so that the person experiencing care is really living the life they want to live, supported to do things for themselves. You know, it's all very integrated and so on. So let's wave a magic wand. COVID is gone, and we're all seamlessly focusing on people's ability to keep well, healthy, and live good lives. So if you can just park the reality of day to day and think about the future. We're going to break you into some smaller groups, and when you get there, if you could have one person who write up the answers to these questions. We're living in the future, and what's happening now that works really well to make this great rehab? What would people experience? What would staff be doing? What would people notice? What would AHPs be involved with? And so on. So Stephen, if you could break us into small groups, that would be great. And I know that takes a few seconds to sort out.
Yeah, no problem. Hi, everyone. So yeah, I'm just going to put you into 3 breakout rooms. There'll be a facilitator in each room. You don't need to do anything. It'll just move you to the room automatically. And when time's up, it'll move you back. So if you just give me a moment, I'll just do that for you.
Okay. Right. Look, nice to be back again. You might like to mute your microphones, because otherwise there's a bit of feedback. Thank you so much. Apologies, when I was doing the slides, I totally missed a section we were supposed to do. I think that was okay. So some of our answers are on this one, and some are too forward.
Louise, you need to reshare your screen again.
Oh, I see. Okay, got to do that. Right. Thanks, Stephen. Make that right. Okay, I'll do that. So, Bryony and Beth, I think, I'm not sure who's going to, maybe between us all, maybe we could kind of pop in to do a little synopsis of what we see here. And indeed, wait till I show you this, because there's some of the information here and some too later. So let's have a look at this one. And Bryony or Beth, would anyone like to pop in and see what they're seeing here, what they've heard?
Well, I can tell you what came from my group. There was lots of really positive feedback again about CAPA, and some of the examples of staff being quite empowered from the programme. Lots of really helpful stories of positive outcomes. I think everyone in my group was quite clear about rehab being wrapped around what the person needs and wants. Val told a really good story about, I won't repeat the full story, but basically just a person who was quite private, and you know, going to the bathroom was quite probably a traumatic experience when being supported, and actually being able to just do that on her own was a massive part of her rehab journey. And I think we then talked about lots of other parts of rehab that are like that, you know, small activities, although I think my feedback was don't use the word activities, it's about lifestyle. What else did we talk about? We talked about sort of empowering staff again to take risks but be supported to do that, so having access to specialist advice. And we then sort of broke that down a wee bit more about what does access mean. So being able to just ask a physio, OT, whoever it is, about just some advice, because the care home staff have probably done most of the pathway themselves. They just need a wee bit of reassurance that what they're doing is the right thing, it's not going to cause any harm, and that all builds back to that kind of less risk averse and actually doing something that matters to the individual. So we talked about that for a wee while. Trying to think if there's anything else major. I think really just we had a lot of chat around CAPA and what that meant to different teams.
That's great, thank you. And of course, now that I'm seeing other people here, I see Val Allen. Hello, Val. And it's so nice with Denise and other people. It's so lovely to see Kent faces there, and lovely to hear the continuing impact of the CAPA programme supporting people to listen to folk and work to promote more movement and so on to improve lives. So that's great. Thanks very much, Bryony. Well, Beth, do you want to pick up on a few things that you heard?
Yeah. So we had quite a few HPs within our group, and they talked about the different models that they're working within. We've heard already about people who are employed by the care home. I think that had come up in one of the previous slides, and it was really interesting just to hear about that model and how that was working. We talked a fair bit about having to, you know, how we access HPs. So we've got an OT in 5 who covers a number of care homes, and that in itself is probably quite a stretch when you think about, you know, one person covering, I think, 8 care homes. But actually, when we need, if she needs an OT or she needs to access other HPs for an individual, you know, we talked about how clunky that could be, going through a GP and having to wait. So there's definitely things around about access. But one of the main things I think that came up was about how do we use our HP resource to really upskill the care home staff. And we talked about the limitations of that, given that, you know, the workforce, you know, turnover, and how do we have the time always to be able to do that. But one of the things that we did kind of question was round about, you know, the cost, and we're saying, you know, it's quite costly to have, you know, that resource within a care home, whether it's the care home staff being upskilled to do some of the rehab approach, or whether the care homes themselves employ HPs and rehab staff. And talked about, you know, how that could be a bit, you know, you can't deliver that because it's too expensive. But actually, you know, on balance, if we're about trying to keep people well and active and participating, then is it money well spent? Because actually the benefits would outweigh the costs probably, and the reduced costs maybe in terms of people's dependency. So I suppose I kind of threw that question in round about it, you know, that economic argument round about it all, and it's maybe not as costly as we think. So Gail kind of finished off by just talking about, on the back of that, how do we keep staff? How do we keep staff upskilled? How do we keep them motivated and getting that satisfaction from their job? And she talked about having really positive role models and the importance of consistency. She talked about, allocating care workers. So there was a bit of a list, and I'm sure they're captured in the slides, in terms of what we could do to really kind of help and support staff to deliver good rehabilitation. So we had a great discussion. It was great to hear people's experiences and their thoughts and reflections on what currently happens and what we could do in the future. So
fantastic, fantastic. And I'll just add one thing, because I know we're running out of time. That really, there was a really passionate plea that when you move it into a care home, that your address doesn't matter. You should get the same input as people elsewhere, and that, to strike off, saying somebody doesn't have the potential to improve, that you won't be written off and saying that's it, but that you're connected with the correct people and approaches in order to keep you living a really good life, the one that matters to you. So, Beth, I know that, if possible, if you were able to speak about what's going to happen with this, and I'll put up a slide where people, if they'd like to, they could say, well, what did they enjoy about today's session, and what would be even better if we were to do this the next time, while Beth is saying what happens with the information here.
So we're really appreciative of people's contributions and the time they've taken to take part today. This is part of, say, the implementation of the Rehab framework. So we've gone out to health boards and health and social care partnerships, and to third sector organisations, and leisure trusts would be the other one I would just flag up, to ask them about good rehabilitation. So similar to what we were doing today, what would it look like in an ideal world, and to try and get an idea of what might be our opportunities for improvement going forward. So the work that we've done today and the previous webinar, all this data will contribute to that as well. So we think that we've got a really rounded picture then of what's happening on the ground in terms of kind of service delivery, and that will help inform our improvement programme as we go forward. I think it's important to say that, if people are really keen to be involved in some of that work, we would be really pleased to hear from people who might just want to step up and say, I would be keen to be involved in some some work programmes, some improvement programmes. So just really looking for people who are keen and interested to be part of that, probably with yourself, Louise, in terms of moving some of these ideas forward. So that's that's hopefully that's clear and helpful.
Well, thank you so much. And everybody, thank you so much for your involvement, and hopefully you may well have signed up to say that we can contact you going forward for such things as Beth has outlined there. And really appreciate your time today, and I hope that the rest of your day is positive, and it was lovely to meet you and hear once more of people's absolute passion for their work they do and their commitment, and we're so it's so lovely to hear that, and that's given me a lift for the rest of the day. So cheerio, and until the next time.